collaborating member for the Strategic Training Initiative of the Prevention of Eating Disorders, otherwise known as STRICT. STRICT, at Boston's Children's Hospital and the Harvard School of Public Health. Dr. Sonneville is a registered dietitian and a behavioral scientist whose research focuses on the prevention of weight-related disorders and the intersection of obesity and eating disorders. It's my privilege to introduce you.
Thank you. I want to start by acknowledging and thanking the Eating Disorders Coalition for organizing this very important group meeting and for inviting me to speak. It is a real honor to be here. I'm going to be talking today about BMI report cards, thinking about why these programs exist, what the intended outcome of these programs are, and perhaps about unintended consequences, and specifically relating back to eating disorders. The content I'm going to cover is going to be conveniently displayed behind most of you on the right side of the room. I will tell you, you can follow along my talk without looking at the slides. There will be a couple moments where I may refer you over to the slides, but do not fear, those in the front row, you'll get the gist of the content. So I'm going to start by highlighting why we're all here, and that's the topic of eating disorders. We know that eating disorders are a major public health problem among youth. Far too many young people are suffering, and we'll have an opportunity to hear more about the true experience of what it's like to have a loved one with an eating disorder from other speakers. But what I will say as someone who has treated young people with eating disorders for more than 10 years, I will say they are extremely difficult to treat. The consequences are severe, and we need to do everything we can in our power to prevent them from ever happening. Which brings me to how we think about the problem of eating disorders from a public health perspective. Because so many people are suffering, we're wondering why. Where are young people? Why might they be challenged with body image and eating difficulties? What are the environmental triggers that may lead to this problem? We're particularly interested in what's going on in schools because that's frankly where young people are. And a lot has been happening in schools. I'm going to draw your attention quickly to the map over on the screen. One thing that's changed quite a bit in the last decade is what's happening to school related to obesity. And several states, starting in 2003 with Arkansas, have implemented or mandated BMI measurements. And all of the states in white are BMI policy free, but the states in the different colors require some type of BMI measurement program. And they vary a little bit. I'll talk a bit about the different requirements and recommendations, but currently more than a quarter of the states in this country has some sort of recommendation or requirement related to measuring BMI in schools. So school-based BMI measurement programs were designed to address obesity among youth, and certainly the obesity epidemic is a real problem. But these measurement programs actually have never been evaluated, and while these programs have been increasing in number, there's been several concerns that have been raised about potential concerns. The first is, may they be ineffective or might they be ineffective? And as I mentioned, they have never been evaluated, so they've never been shown to actually help the issue that they were designed to address. And if they're ineffective, they are a huge waste of public health resources, and they're really distraction from attention to programs that may actually be helpful. The other concern is that they could potentially cause harm. They could stigmatize students, and programs that involve public weighing and reporting of this information in an unstandardized way could lead to harmful behaviors such as disordered eating and dieting. So there's two main types of BMI measurement programs. One is BMI surveillance, and the other is BMI screener BMI report cards. In both programs, students in schools are being weighed and measured. In BMI surveillance, the school is just holding on to the information and is using the information perhaps to compare rates of obesity to schools in the neighborhood, or looking to see if rates are going up or going down. In BMI screening or BMI report cards, that information is actually sent home to parents, hence the name BMI report cards. And the goal of these programs is really to motivate. We're going to send them a letter, tell you your child is overweight or obese, and motivate you to do some healthy things. But there's a lot of assumptions that went into the development of these programs. And when you think about assumptions of a public health program, you have to think about assumptions related to how are they working, how are they going to help the thing you want them to help. and assumptions about harm. Is there anything that we have to make sure is happening that they're not actually doing any damage? In both types of program, we're making an assumption that weighing youth at school is harmless. Now I'm going to talk about the assumptions a little bit more in a minute. I'll let you sit with that as an assumption. The screening programs, which are the programs that are sending BMI report cards home, are operating on several more assumptions. One, that youth is not aware of his or her obesity status. That awareness of obesity status is essential for healthy behavior change. And finally, that youth and family will have the necessary knowledge and resources to make changes. There's many more assumptions, but these are the few I'm going to talk through. So I'm going to start with the first assumption: weighing youth at school is harmless. I'm going to put a picture and draw your attention over to the screen. And I want you to think to yourself, do you have any concerns about this picture? At first glance, they look relatively happy or smiley, these two individuals. When I look at that picture, I wonder, who is the woman on the left? Is she a nurse? Is she a volunteer? Does she know how to use sensitive language related to weight? What if the student who's being weighed starts crying? How will she respond? Does she have any training? The other concern I have is, I think she's in the corner of the classroom. This does not appear to be a private or sensitive place. It seems like a sort of very public weighing type situation. And the truth is, all of the states that have programs related to BMI measurement don't mandate who is the person who is weighing young people and where is the weighing measuring. These types of ways, where is the weighing happening? And these types of lack of sort of standardized practices really have the potential to cause harm. We also know that weight concerns about dissatisfaction are already extremely high. Our society in general is so weight preoccupied and weight focused that you can imagine a young person that's getting a scale is not a blank slate. They're already coming with sort of a lot of concerns or worries perhaps about weight. We know in Arkansas, the first state that passed BMI report cards, that in a review of that policy they did, where they interviewed young people who had been weighed in school, the overweight kids were particularly embarrassed by the BMI measurement. Not surprising, those are the young people who are struggling most often with body image issues. We also conclude that weighing students may worsen weight stigma, which is already extremely high in schools and society at large. The next assumption is that youth is not aware of obesity status. Well, in fact, BMI is routinely measured at a doctor's office. The American Academy of Pediatrics is recommending that clinicians are weighing and measuring young people, looking at their BMI, and reporting that information back in whatever way is appropriate to the youth and the family. And what's important about the clinical context is that clinician can look at that child, look at all of their weight history, know, is this what the child's weight usually is, or has there been a really rapid weight gain? They can look at the parents' weight, they can ask about behaviors. Is this kid very active? Is this kid eating well? Is there really a concern here? Whereas in the school environment, you get a sort of one-time snapshot of what the weight status is, and we're drawing a lot of assumptions about the information we should be communicating back. The next assumption of these BMI report cards is that awareness of obesity status is essential for healthy behavior. So what we're assuming here is that if you are overweight or obese and you know that is your weight status, that is a good thing. What is so interesting is that data will tell us the opposite may in fact be true. If you compare overweight who know they are overweight or overweight youth who know they're overweight or obese to overweight youth who think their weight is fine, their behaviors are actually a lot worse. They're more likely to skip meals, use diet pills, and smoke cigarettes for weight control. So all these behaviors that are really gateway behaviors to full criteria eating disorders. The other thing that's interesting is they actually gain more weight over time. So this program is designed to prevent obesity or to slow obesity may actually be contributing to the obesity epidemic. The final assumption is that youth and families will have necessary knowledge and resources to respond appropriately to these BMI report cards. Again, there's no really standardized practice of what is included in these report cards, and there's no guarantee that any sort of meaningful information or strategy will be communicated. To compound that, there's not a lot, there are many areas that don't have a lot of great resources to respond to excess weight gain, and so there simply isn't good resources to provide in those letters. And because weight is not a behavior, it leaves the young person, the family, to sort of figure out what to do. It's not like we're saying, change this particular food behavior, change this watching of TV or eating of fruits and vegetables. It's saying, your weight's a problem, fix it. It's like saying, your blood pressure's a problem, live up with it, right? Giving this information without a strategy is is not going to address the issue at hand, and without meaningful strategies, it really puts people at risk for adopting harmful behaviors. Again, these behaviors are worrying about skipping meals, using unhealthy weight control practices that again are gateways to the development of eating disorders. So we must proceed with caution. Our top priority needs to be creating healthy and safe school environments for young people. I mentioned there is no evidence that BMI measurement programs reduce obesity. In fact, they could worsen weight stigma and increase risk of eating disorders. And if these programs are going to continue, it is essential that the effects of these programs, both the intended outcomes and unintended consequences, are evaluated.